Cycling England has for the last 3, almost 4 years now, been working on 2 major programs. One is very much about how we encourage a complete change in behaviour in a whole town. Ultimately, hopefully, a cultural change in attitudes and behaviour towards cycling. And so we've now got 18 towns set up, and we're investing in those. The second plank of our programme has been very much about the next generation, about young people, about teaching young people to ride, to learn to ride safely and well on the road, and to have fun riding their bikes, to make that a life skill and to make learning to ride a bike a rite de passage, a real change in their view of how they conduct one aspect of their life. In order to continue the work of Cycling England, we think it's important to be able to go back to the government by the autumn of 2010 with some new ideas as well, and say, we've done these 2 things and they work and they can be scaled up, but here are 2 or 3 new ideas which we'd also like to show you may well produce results and are worth investing in. The 3 ideas that we're working on at the moment, and these are very much under development, and they're not yet finally agreed with the department as to how we will fund them. The funding is available, but exactly how we will fund them is not sorted out. And the final brief is not written yet, but we can talk about it in general terms. And there are 3 elements. One is to do with cycling and the station. One is to do with cycling and leisure. And the third is about cycling and work. All of these have at their heart a very simple idea, which is that of a hub. From our experience over the last 3 years, we have found that where you can get people in a community, maybe quite a small community, but if you will, a hub of people, you can start to influence and change behaviour and ultimately attitudes. And it's very much more cost effective to do that where you've got a community than it is to try and pick people off as individuals. It's very often there are some very, very good schemes which are quite small, perhaps focused on people who have been ill, who need to take up cycling as exercise. But inevitably they're very disaggregated and they're hard to manage and they're hard to monitor and prove the results of. So really what we're trying to do is to find hubs, and of course you may say we found one already which is perfect, which is schools. Schools are wonderful hubs. They create a culture of their own. We believe that the station may well prove to be another very attractive hub, and we're discussing with the Association of Train Operating Companies whether or not there might be some train operating companies who would like to become, if you will, cycling demonstration train companies, who would be prepared to put forward a proposal, would be prepared perhaps to part fund or make a significant contribution to any funding that Cycling England provided, to doing something quite dramatic with a section of their company. The second idea is about leisure, and here we know that people love cycling for fun at the weekends, usually off-road, probably around the edge of a reservoir in centre parks and the Forestry Commission, National Trust. The question that we keep asking, and I know lots of people are asking, is it possible to turn somebody who loves cycling for leisure into somebody who actually leaves their car at home for those short journeys during the week, to the pub, to the post office, to pick up a prescription, to get a newspaper, that many of those journeys which could so easily be done on a bike by somebody who gets on their bike at the weekend and yet somehow or other just doesn't do it at home during the week. And so we're looking at a couple of possibilities of working perhaps with a national park, perhaps with a county, on whether or not we can trace people who cycle for leisure, talk to them during that leisure experience, and then track their behaviour afterwards and see whether we can persuade them to take up cycling as a rather unattractively called utility trip. And the third thing is, of course, that more difficult journey, which is cycling to work. All of us, I think, have been struck by the fact that cycling is extremely healthy. The largest single employer in the UK is the National Health Service. Still more than 1 million people working in the National Health Service. So, please. And with more than 1 million people working in the National Health Service, there surely ought to be an opportunity for those people who are preaching healthy life to practice what they preach and increase the amount of cycling to work by so many people who go to a hospital each day. And if we can find some hospitals, perhaps in a discrete region, who are prepared to do a major exercise on encouraging cycling, rather as we've done with Bike It in schools, and perhaps we can draw in a big medical school as well, such that young men and women who are training to be doctors and nurses take it on themselves to travel when they can by cycle, and then when they are preaching good health to their patients, say, I know, I do it, and it works. And so we're trying to discuss with regional directors of public health at the moment whether they might participate in such a scheme. So these are 3 new ideas that we're hoping to get off the ground very shortly, certainly within the next 3 or 4 months.